Good afternoon, everyone. My name is Dr. Surbhi, Junior Resident, Department of Psychiatry, and today I'll be presenting my seminar on the topic of disorders of form of thought. I'll be covering my seminar under these headings: Introduction, Types of Thinking, Classification of Disorders of Thought, Disorders of Form of Thought, Formal Thought Disorders and Schizophrenia, and Summary and then References. Introduction. Thinking refers to the ideational components of mental activity, processes used to imagine, appraise, evaluate, forecast, plan, create, and will. Schneider suggested there were three features of healthy thinking: constancy, continuity, and organization. Types of thinking. There are three types of thinking: undirected fantasy thinking or autistic thinking, imaginative thinking, rational or conceptual thinking. Fantasy thinking. Fantasy is usually understood to be the creation of images or ideas that have no external reality. It may also reveal itself in the denial of external events to compensate for disappointments in life or to escape from unpleasant situations. Denial of external events, ego defense mechanisms, blurred, excessive autistic thinking in schizophrenia is part of thought disorder. Imaginative thinking. The term imagination covers psychological states such as fantasy, the generation of novel ideas, and the creative outputs that constitute art or discoveries in science. Has three components: mental imagery, which creates the image based mental representations of the world; counterfactual thinking, capacity to disengage from the reality and think of events and experiences that haven't occurred; symbolic representation, use of concepts or images to represent real world objects; rational or conceptual thinking, problem solving and reasoning. Problem solving, cognitive process used to overcome the obstacle to reach a goal; reasoning, cognitive process used to make inferences from knowledge and to draw conclusions; analogical reasoning, which is application of solutions to already known problems; inductive reasoning, use of specific known instances to draw inferences about unknown instances; deductive reasoning is argument in which, if the premises are true, conclusion cannot be false. Healthy thinking. Schneider suggested that there were three features of healthy thinking. Constancy. This is a characteristic of a completed thought, that it does not change in constant unless and until it is superseded by another consciously derived thought. Organization. The content of thought are related to each other in consciousness and do not blend with each other but are separated in an organized way. Continuity. There is a continuity of sense continuum so that even the most heterogeneous subsidiary thoughts, sudden ideas, or observations that emerge are in order in the whole content of consciousness. Classifications of disorder of thought. Now, disorders of thought are classified into disorders of stream, possession, content, and form. The disorders of stream of thought, they are furthermore divided into two types: thought tempo and the disorders of continuity of thought. So disorders of thought tempo have flight of ideas, inhibition, slowing of thinking, and circumstantiality, whereas continuity of thought has perseveration and thought blocking. And the disorders which have been highlighted in different color are the ones which are covered under the heading of disorder of form, thought of disorder of thought of form, formal thought disorder in CTP. Obsessions, compulsions, and possessions of thought. It covers obsessions and compulsions, thought alienation, which furthermore covers thought deprivation, thought broadcasting, and thought insertion. The disorders of content of thought. It comprises of primary delusions, secondary delusions, or systematization. Now, the topic: disorders of form of thought. Formal thought disorder is synonym for disorders of conceptual or abstract thinking and is most commonly seen in schizophrenia or organic brain disorders. Disorders of form of thought, the prevalence. About 50 to 80% of people with schizophrenia have the disorders of form of thought. 60% of schizoaffective disorders have this, and 53% in depression, and 6% in healthy control cases. Disorders of form of thought. Schneider claimed 5 features of formal thought disorder: derailment, substitution, omission, fusion, and driveling. Disorders of form of thought is difficult to distinguish from each other in clinical settings. First is derailment. In this, the thought slides onto the subsidiary thought. So for an example, there are 3 dogs in my house. The first is called Tommy, the second is called Lucy, and the third neighbor cat is such a menace. My 3 dogs despise it, so my dogs chase the cat. So here the cat is a subsidiary thought, which has very conveniently entered the whole thought. Then the substitution. Major thought substituted by a subsidiary thought. Example, we were going on vacation. We were having a good time. Luckily, the mechanic helped us. Omission. Senseless omission of thought or part of thought. Thought withdrawal is actually the subjective experience of thought block or omission. Example, the cat is on the table. The moon is bright. So the patient was talking about the cat, and all of a sudden, the patient starts talking about the moon. So there's this omission of thought. Fusion. Heterogeneous elements of thought are interwoven with each other. So cat shaking the jump to black the scratch fur is table was tall. Dribbling. Disordered intermixture of constituent parts of one complex thought. Patient during an interview with the psychiatrist say that I would like I would like watch a book rather than reading a watch. Disorders of form of thought. So here, as per CTP, we have derailment, tangentiality, neologism, incoherence, loose association, clang association, and word approximation, which is also known as metonyms. Circumstantiality. Non-linear thought pattern. Thinking proceeds slowly with unnecessary trivial details, but finally the goal is reached. Goal of thinking is not lost completely, proceeds in intricate and convoluted paths. For an example, a 79-year-old woman is describing her headache to the doctor. They usually start in the morning. I'll wake up at 6:30, and then by the time I have my coffee, well, sometimes I have tea. I like it with lemon and just a bit of sugar or honey sometimes. I always take milk with coffee. And like I was saying, after coffee, I may turn on the TV for half an hour. Tangentiality. A 40-year-old man with depression is being evaluated by a psychiatrist. Have you had problems sleeping through the night lately? And the patient says, I usually sleep in my bed, but now I'm sleeping on my sofa. So the patient did touch the topic, but then he went somewhere else. Verbigeration. Verbigeration speech is reduced to senseless repetition of words, sounds, or phrases, a form of stereotypy, a type of incoherence. Example, a dog, cat, ate, car, work. Clang association. Thoughts are associated by sounds of words rather than by meaning. Example, through rhyming, a 31-year-old man in the maniac phase of bipolar disorder was asked if he had any trouble sleeping. So he replied, I never have trouble sleeping, I never have trouble peeping, I never have trouble pooping. Neologism. New words are constructed by a patient or ordinary words are used in a new way, mainly in schizophrenia. A 25-year-old man with a diagnosis of chronic undifferentiated schizophrenia described his activities during a pass from a psychiatric hospital. We went to the park. It was hot, but not too hot. It was burging. So there's no word like burging. Incoherence or word salad, pattern of speech that is incomprehensible, confused, or unintelligible mixture of seemingly random words and phrases. Set of words or phrases used together without any arbitrary connection or grammatical rules. Schizophasia is the speech confusion or word salad which occurs in the patients with schizophrenia. For an example, why do people comb their hair? Because it makes a twirl in life. Blue elephant isn't lettuce brave. I like electrons. Hello, please. Loosening of association. Pattern of spontaneous speech in which things said in juxtaposition lack a meaningful relationship. There is idiosyncratic shifting from one frame of reference to another. The speech is often described as being disjointed. Example, I like to dance, all people have hands. I like to play games because the river is flowing down a mountain. Formal thought disorder, which are seen in the patients with schizophrenia. So Blur regarded schizophrenia as a disorder of association between thoughts, which were characterized by a process of condensation, wherein the two items with something in common are blended together. Displacement, one idea used for associated idea. Misuse of symbols, concrete thinking. Cameron, in the year of 1944, coined the term asyndesis, which meant lack of adequate connections between successive thoughts. And he also coined another term, which was over-inclusion, inability to narrow down the operations of thinking and bring into action the organized attitudes and specific responses relevant to task at hand. For example, what are the essentials of a room? When asked, the patient would reply walls, doors, chairs, and windows, and the patient might answer chairs. Goldstein, in the year of 1944, he said that loss of abstract attitude in patients leading to concrete style of thinking. So vocabulary is not lost in schizophrenia, whereas vocabulary is lost in patients with organic brain disorders. Disorder of form of thought and cognition deficit can coexist. Reach in three different disorders of thinking that correspond to three features of normal or disordered thinking. So peculiar transitoriness of thinking, lack of normal organization of thought, desultory thinking. Objective thought disorders are further of three types: transitory thinking, dribbling thinking, and desultory thinking. In the transitory thinking, it's a combination of derailment, substitution, and omission. The patient is grammatically and syntactically structures in the patient's language, they are disturbed. Dribbling, Revealing thinking, patient has preliminary outline of complicated thought with all necessary particulars but loses preliminary organization. Therefore, all constitute parts are muddled up. So patient has a critical attitude towards their thoughts, but these are not organized. Desultory thinking. Speech is grammatically correct, but sudden ideas force their ways in from time to time. Each one of these is simple thought that, if used at the right time, would be quite appropriate. Neurobiology, a formal thought disorder. Evidence of synaptic rarefication in the glutamate system of superior and middle lateral cortices, diminished cortical volume of the left superior temporal gyrus, reversed hemispheric activation of speech production and semantic network dysfunction. Further work is needed, especially in relations to negative thought disorder. Accumulating neurobiological findings provide a fascinating new window into underpinning of formal thought disorder, especially in the cases of schizophrenia. Summary: formal thought disorder is an abnormally in the form of thought rather than the content of thought. So the formal thought disorder is not seen only in schizophrenia, it can also be seen in other disorders like depression, mania, ADHD, delirium, dementia, and even substance use. Thought, language, and communication disturbances describe the formal thought disorder in a more accurate manner. Thought assessment must routinely be done for every patient as a part of MSc. Neurobiology of formal thought disorder is a huge scope of potential research and clinical implications. My references were from Fish and CTP. Thank you.